We have with us Dr. Sabah Azhar Bukhari. Dr. Sabah Azhar Bukhari is a senior staff physician at Henry Ford Health, American Board of Internal Medicine and American Board of Geriatric Medicine certified. She is also leading the Michigan chapter of Imamiya Medics International Women's Wing.
Assalamu alaikum, everyone. I welcome you from IMI Michigan chapter to this medical webinar. And in reference to this webinar, it's about cancer and smoking. And the goal is to create awareness about lung cancer and risk factors associated with smoking.
Our first speaker will be Dr. Yusra Shao. She's an assistant professor in the Department of Oncology at Karmanos Center, which is located at Wayne State University.
If I was to mention lung cancer, many of you, or if I was to mention smoking and cancer relationship, many of you may first think about lung cancer. And that is very true. 9 out of 10 lung cancer is related to smoking, meaning if those 9 individuals had not smoked, they would not have developed lung cancer. Having said that, smoking has been known to cause 16 different types of cancer in the entire body. So if we were to just start from head to toe, mouth and oral, voice box cancer, cancer of the esophagus, the food pipe, of course, lung, bronchus and tracheal cancer, blood cancer, leukemia, which unfortunately is a very lethal type of cancer, liver cancer, cancer of the pancreas, stomach, kidney, bladder, pelvis cancers, which are my areas of special expertise, and then uterine cancer, so cancers of the female genitourinary tract, and also colon and rectal cancer. As we know, the incidence of colon cancer has increased in the last several years, younger and younger patients being diagnosed with colon cancer and unfortunately dying of colon cancer. And some of this may be attributed to lifestyle changes such as smoking. So cigarette smoke, apart from these carcinogens, is actually known to have 7,000 different chemicals. Just imagining that enormous number of 7,000 different chemicals that our patients might be inhaling into their bodies. And out of those, 70 are known to be carcinogens. So what about secondhand smoke? Someone might say, well, doc, I don't smoke, but my husband does, or my son smokes. What about that? We know that 7,000 lung cancer deaths every year are attributed to patients who never smoked, but were exposed to secondhand smoke. If we were to look at this box right here, newborns who are born into the houses where there are smokers, the urine level of these carcinogens is high. And unfortunately, these levels are known to cause cancer. So how do we overall decrease the risk of cancer from smoking? The number one thing is to stop smoking. So let's say if a 50-year-old patient today was to decide, I'm going to stop smoking, how does this affect their risk of cancer long term, right? So for 5 or 10 years, from their stop date, they can expect that the risk of head and neck cancer is going to be cut in half. By 10 years, there is a much lower risk of bladder, kidney, esophagus cancer. Again, by 10 to 15 years, the risk of lung cancer is going to be cut in half. But what's also important to note, even if I was to stop smoking today, it takes time for the body to recover. So the sooner you make this decision, the better for the body. Okay? It can take up to 20 years for the risk of pancreas cancer to decrease. And then also the risk of cervical cancer over time will become half of the risk that you may have today.
So now we're going on to our second speaker, Dr. Tariq Hadid, who is a medical oncologist and member of the Head and Neck and Thoracic Oncology Multidisciplinary Team at the Karmanos Cancer Institute.
Lung cancer is a common cancer. 1 out of 5 people have 1 out of 5 cancer patients have lung cancer. It's extremely common and it's extremely deadly. Worldwide, we see about 3 deaths from lung cancer every minute. So it's a huge amount of people that actually we lose because of the lung cancer. On this slide, you can see that there is different survival by stage. For example, on the left side here, you can see stage 1 lung cancers. There's multiple types of stage 1. There's stage 2 here. You can stage 3 and stage 4. And you can see the chances of survival at 5 years is higher if you have stage 1. It's lower if it's stage 2, a little bit lower if stage 3, and if you get stage 4, the chance of living 5 years after diagnosis is very low. So primary prevention of lung cancer, like we talked before, primary prevention is preventing the cancer from happening before it happens. So it's quitting smoking, all type of cigarette use or other tobacco use has been linked to lung cancer. So quitting all type of tobacco is extremely important and critical. That's include hookahs, include betel nuts, include other cigarettes and e-cigarettes and vapes and all type of tobacco use. Avoiding exposure to asbestos. Asbestos can reach the person can be exposed to asbestos through their houses that are built before the 1980s. Most likely they will have some asbestos in them, in the paint and the other structure of the house. So if you have a house that is built before that time, it probably should be evaluated to assess whether it has asbestos in it, and find ways to kind of avoid that or cover that by certain methods. Radon exposure has also been linked to lung cancer. Radon is a natural radioactive materials that comes from the environment, specifically from the rocks and from the earth itself, and it can enter the house through the cracks that you see in the basement or in the lower levels of the house. At a lower level, exposure to radon is not a big problem, but certain areas have higher exposure to radon, and when the person gets exposed to a larger radon dose, that can cause lung cancer. So for that, it's recommended that people inspect their houses, make sure all the cracks, especially the basement and lower levels, are closed and covered, and there's no connection between the ground and the house itself. Secondary prevention of lung cancer means preventing the cancer or finding the cancer at earlier stage. Like we talked before, stage 1 have much better outcome than cancer that found at stage 3 or 4. So the aim is to try to find cancer at earlier stage. In the past, they have tried to do X-ray to find the cancer at earlier stage. That has failed. So X-ray does not detect cancer at earlier stage and does not prevent death from lung cancer. So it's not recommended. However, CT scans is known to prevent lung cancer or finding lung cancer at earlier stage. Like you can see here, there's a small little nodule that you can see in the lung here, a small spot in the lung that you can see. It's probably a stage 1 lung cancer that can be treated easily, and the patient has a very good chance of surviving. A CT scan of the chest does not require any injections, and it only takes about 10 to 15 minutes to be performed. It can make a big difference in the person likelihood of survival.
Our final speaker for today is Dr. Sara Hussain. She's a board-certified internal medicine doctor practicing since 2009.
I feel like ask them, why are you smoking? I mean, what makes you smoke? Is it your peers? How much are you smoking? When do you smoke? Is it the boredom? Is it the overwork? Is it so going into that depth, going into that really dark zone and having that trust that your patients can tell you everything? That's very important. And then see how they are responding to you. Are they just like, let's talk about this later, or they're willing to quit, and then build up that conversation. I usually have my patients leave with like, hey, promise me you will quit next time, or you would go down on your cigarettes. So that creates a lot of trust, and I think that is very important. There are gums, nicotine gums available, there are lozenges available, and that these are all over the counter, which is a great thing. The nicotine inhalers are also available, the sprays are available, but they are with prescription in US. The medications that are used are varenicline, a 0.5 milligram tablet, and you titrate the dose to see how the response is, and the bupropion, 150 milligram per day, and you can titrate the dose as well. Now, the patients, when you tell them, hey, go and buy this patch, it will be wonderful, they would never buy it. So you have to talk to them. Hey, go downstairs, we have a pharmacy downstairs. These patches are just $35 for 14 patches. You can actually save the same money by not buying the cigarettes and then buying the patches. I have tried hypnosis on a lot of my patients. I have gotten great results. The only problem with hypnosis is that it's not covered by insurance. As soon as the patients hear this, there's a red flag and they're like, okay, I don't want to pay out of my pocket, although it will be less expensive if they actually quit and they go for hypnosis. E-cigarettes, the e-cigarettes have been FDA approved, but they have not been approved as a medical product for smoking cessation. So they still is a lot of data that needs to come out to see their safety.
I appreciate each and every one of you. And I just hope that we can continue to do things like this to help our community and whatever knowledge we can give them.